Myself, Dr. Sarita Behera, Assistant Professor, Department of Medicine, SCB Medical College, Cuttack. Today's topic of discussion is obesity, increasing vulnerability for hypertension, a burning topic. The prevalence of obesity and high blood pressure is consistently increasing nowadays, not only in adults, in children as well. Obesity, initially believed to be the disease of higher income countries, is also prevalent in low middle income countries. In India, there has been increased prevalence of obesity for last 10 to 15 years, with one-third of adult population are estimated to be overweight or obese. Indian and Asian ethnicity has a high burden of obesity and lower muscle mass as compared to the Caucasians and are more prone for vulnerable they are for development of chronic diseases like hypertension and diabetes. Now, to define obesity, we can say the key measure of obesity is body mass index BMI, which is determined once individual's weight in kg divided by height in meter square, and a normal BMI values between 20 to 25, whereas 25 to 29.9 indicates overweight and equal to more than 30 is obese. This obesity, this BMI has high correlation with the amount of body fat in most populations. Abdominal or central adiposity is another key determinant of fat distribution, and it has greatest influence on vulnerability to development of hypertension. A waist circumference of more than 40 centimeter, 40 inch in males, that is equal to 102 centimeter, and in females it is 35 inch equal to 88 centimeter, and the waist circumference more than that indicates there is obesity. And reasons of rising obesity, we can say the basic cause for obesity is an imbalance between energy expenditure and energy intake. However, numerous factors have contributed to rising prevalence of obesity among the population, such as urbanization, increased industrialization, changing diet habits including increased consumption of processed food, fast food, and increased calorie laden soft drink beverages, they are increased calorie laden. And sedentary lifestyle with increasing screen time is also another important factor with minimal physical activity. And of course, genetic predisposition has got some definite significance. Along with that, psychological factors such as depression, low self-esteem, etc. And of course, last but not the least is socioeconomic status. And how obesity is related to hypertension, what is the link? During obesity, the increase in fatty tissue increases the vascular resistance, and that consequently increases the workload of the heart to pump the blood to the different parts of the body, and thus primary hypertension is consistently gaining significance and prevalence in association with obesity. Studies report that hypertension is 34 times more significant in obese children than non-obese. And now, what should we remember from this hypertension and obesity link? Though antihypertensive medication are helpful in lowering down the blood pressure, prevention is still better than any medication. Achieving weight loss can significantly reduce the blood pressure and and may also permit a decrease in number or amount of medication taken. A study estimated a blood pressure drop of 4.3 to 3.8 millimeter of mercury in hypertensive patients with a weight loss of 10% within the period of 4 years. Following lifestyle changes, it can be helpful to reduce weight and hence hypertension. So, what are those lifestyle changes? Let us discuss. Most important is diet. You take one bucket of water and it will go out through kidney, but if you take 1 spoon of extra calorie, it will add to your fat content of the body. Opting for DASH diet, that includes eating fruits, vegetables and low fat dairy products. Reducing dietary salt or sodium intake 5 gram of salt per day, that is equal to 1 teaspoonful of salt, and being physically active at least 30 minutes per day physical activity is required, and of course important is limiting alcohol intake. It might be difficult to achieve and maintain weight loss. This must be the primary target for the management of obesity related hypertension. Weight loss would surely be beneficial in managing your blood pressure, if not to normal, but at least to some extent with definite benefit on risk progression. That is why the doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet and in the cause and prevention of disease. Not me, said by Thomas Edison. Thank you.